I'm Jerry Hesch, physical therapist at Hesch Institute in Aurora, Colorado, and my client Justin presents with a sacral torsion, and the theory on sacral torsion is that it is a twisting phenomenon of the sacrum within the two iliac bones, and no one has studied this. The standard of diagnosis would be with stereophotogrammetry. That's a very sophisticated way of measuring very minute motions in joints, and that has not been applied to this joint. Some people may speculate that it's just a muscular and postural phenomenon, and we really don't know, but what I'm here to present is simple passive motion testing through the sacrum, and we will treat him, and then we will check his response to treatment. And so basically the theory is that there is an oblique axis about which the sacrum can rotate about, and it also, in addition to rotating, it can side bend. And so I'll use the small sacrum here. And so moving about what's called the left oblique axis. It's named because the top of this axis is on the left side, and the actual articular surface of the sacrum is right here on each side. And basically, if it rotates to the right, then the lower part of the sacrum, the lower quadrant on the right, becomes prominent. It moves posteriorly, and it also side bends, so it drops down on the left side. Now, I'm sure that we will not be able to visualize that on his body, but the bottom of the sacrum is right here. And so as I walk up the sacrum with my thumbs, I'm on the mid-sacrum now, and I'm on the upper sacrum. On the lower part, my right thumb is posterior, okay? And when I attempt to create passive force through the right lower quadrant of the sacrum, there's no mobility, and I'm using a reasonable amount of force. And if we compare that on his rib cage, you can see his whole body moves because this is a mobile structure, okay? But this motion is restricted in the right lower quadrant. When I come over to the left lower quadrant, do you see that there's some movement? That's called taking up the slack. I take up that movement, which is easily accessible with about 15 pounds of force, and I maintain that pressure, and then I impart a little impulse, and I can see his feet move. So that force goes into the body, and it goes through the pelvis, through the pelvic joints, and into the lower and the upper body. And on the upper left quadrant, I can also get spring mobility, and on the right upper quadrant, I can get spring mobility. Now, it's rare to see a sacral torsion with the client prone, with the lumbar spine in relative extension. I see them more frequently in a flexed position, so I'll show you what that looks like. So let's have you sit and face me. And in sitting, we have the upper body weight coming down, and that basically takes up the slack already. And so when we do a spring test on the sacrum, and I can see that prominent, this is more posterior on that lower sacrum. When we do a spring test in sitting, it's more of a quick impulse, okay? And you can hear the table move, and you can see his body move with that test. And if I come over to the right side, there's no movement, and I'm doubling that force and increasing it even more, probably applying 40 pounds or 50, and there's just no give. That structure is not moving, and the upper quadrant moves, and the left upper quadrant moves as well. Could you give us a really brief synopsis of your journey with your injury?
About 10 years ago, at the age of 35, I began having lower back pains that every once in a while would caused me to have to lie in bed for up to a week. I would be treated by my primary care physician with muscle relaxants and the problem would go away. I eventually decided to start a weight training program thinking if I strengthen the muscles that won't be a problem anymore. And that did in fact work for maybe 3 years. Then one day I was performing a deadlift and I felt and heard a pop in my right buttock area, and since then I've had extreme pain in that area to the extent that I've been unable to work very much at all. Most of the time I'm lying in bed. I've seen 4 surgeons, 4 physical therapists, had several procedures done ranging from sacroiliac steroid injections 3 times in the past year, to lots of physical therapy, ice, any number of treatments, chiropractic, etc. But the problem has not gone away. I'm often at a 6 to 7 on the normative pain scale. I treat it with ice, which actually probably works the best, just basic ice. But my quality of life is pretty bad. I'm on hydrocodone a regular amount of the time.
Very good. Thank you very much for that. And so we'll stop filming shortly, and I will treat you, and then we will come back and film response to treatment. Thank you.